Hi guys, my name is Karen Dees. I am the marketing manager for Patient Concierge Services. For those of you who don't know who we are, we provide a full wraparound service from beginning to end for anybody exploring plastic surgery in Bali. So, part of our amazing service is getting to know the choice of doctors and plastic surgeons, and we are very honoured today to sit with Dr Tasha here at Beyoutiful Clinic in Denpasar and learn more about her and the clinic, and also a little bit about Dr Tompi as well. So yeah, Dr Tasha, how long have you been a plastic surgeon?
I'm about 10 years.
Wow.
Plastic surgeons, yes. It starts in about 2015, I think.
Yeah, has it gone fast? Yeah. Time flies when you're having fun.
Time flies. Time flies when you're having fun.
Yes, absolutely. And what made you decide to be a plastic surgeon?
Well, I want to work and spend my life with doing I'm passionate about. So I love arts, I love music, and I love also drawings, designing things, and make something beautiful. And I love medicine as well.
What a fantastic combination.
Yeah, it's a fantastic combination. So what best for me?
Yeah. So you must feel real satisfaction by applying your creativity in plastic surgery that really empowers people.
Yes, I love to empower women.
Yes, I love that. It's a real honour for me when I'm talking to plastic surgeons because one, I'm uber passionate about anything that empowers a woman, and I just find it fascinating that somebody can really invest in their appearance and it affects them emotionally, physically, spiritually, you know, and it's like we spend money on our house, on our car, and for some reason, you know, there is a little bit of a stigma still out there in investing in yourself for plastic surgery. So I really want to break that stigma. So I'd really love to know what kind of plastic surgeries can you do, and what would be your favourite one?
Okay, I do like aesthetic plastic surgery and also reconstruction plastic surgery.
Aesthetic and reconstruction.
Yes.
Okay.
Yeah, aesthetic is like a face, breast, Botox.
Botox,
yes. And then for the procedure of the reconstruction, it's just like facial trauma, something.
So would that be like if somebody had an accident or maybe like a birth defect or something like that? Yeah.
Like cleft also.
Cleft palate,
Cleft palates, and also the procedure of the accident, as you said.
Your favorite is the mid-facelift?
Mid-facelift thing.
Okay.
This procedure like requires refinement and requires a good knowledge of anatomy of the face.
Oh.
This procedure only takes 2 hours.
Really?
With low risk compared to other surgeries.
Okay, break it down for me if I wanted it. Where do you go? Where's the incision and what are the results?
So the incision will be here.
Like a lower blast?
Lower blast.
Okay.
But it's like lifting all this side, the mid-face.
I love it.
Like reduce these lines. Okay. You hit these lines,
right? Are they called marionette lines?
Marionette lines.
Okay.
It's a natural level.
Okay. So they improve the mouth lines from here to here.
Yes.
But not the jaw and neck.
No.
Okay.
No.
But that's a really good point because I guess you probably have experienced it, and I do too, is part of our job is to manage expectations. People are like, oh, you're a plastic surgeon. Do you have a magic wand? Some people are like, oh, you're going to take me back to when I was 19. But I think it's really important to say where it improves and where it doesn't improve. So for somebody who had good appearance of jaw and neck, but they wanted to improve from here to here, this would be good option
and
for them.
baggy eyes as well.
Baggy eyes.
Yes.
Okay.
This procedure have it all. Baggy eyes and mid-face lifting as well.
Okay. Talk to me like I'm a 2-year-old. How do you do it?
So we can do the incision, like lower blepharal incision.
So it's close to the, is it called waterline?
Yes.
Okay.
Yes. And then we like separate all the fat and also the muscle.
Okay.
So the fat, we reposition the fat.
Okay, so you reposition the fat, would that be if there's a hollow part?
Yeah, we have this hollow part.
Like the teardrop?
Yes, teardrop. And then we have bulging side. We don't remove it at all.
Because we want to
we need it.
We need it.
We need it.
Okay.
We move it to this teardrop.
Yeah.
And then we put the muscle here. We have to like lift the muscle here.
Okay.
So it can cause this one much more good.
Okay, beautiful. And how long would you say it lasts?
As long as you live.
So it would be a permanent improvement. But of course,
if you get older, yes, of course.
We don't freeze time.
Yes.
Yes. Oh my God, this sounds so good. And have you got any idea how much it cost?
I don't know about that.
No problem. If you want to know, send us a WhatsApp message. So lots of our viewers on our social media channels, and including our private Facebook group called STAR, which is Surgical Transformation and Aesthetic Rejuvenation, as well as the other Facebook group called Facelift in Bali, which is founded by Pamela Lovegrove, equates to something like 26,000 people that we try and communicate with. A lot of you guys really don't know where to start. How do you research a surgeon and what are the kind of things that you look out for? So Dr. Tasha, please help these people. Like if they're from Australia or from somewhere else in the world, what kind of things should they be on the lookout for when choosing a plastic surgeon in Bali?
Okay, for that, you have to do like a little more about homework. Digging some information about this plastic surgeon.
Okay.
Maybe first you have to know where the plastic surgeon works.
Okay.
Is it the well-known hospital?
Yes.
Good clinic?
Yes.
Something like that. So because of the hospital and also the clinic will have
like their own standards.
Yes.
Yeah. Clinical standards. Mm-hmm. Yeah. So you want to see like the environment that they're working in.
Selective.
Yeah.
Mm-hmm.
Oh, okay. This is really good information because I didn't know that either. So the hospital is selective about which doctors they allow to work there. Oh, so their workplace is a reflection of the doctor too.
Of course, yes.
Interesting. Mm-hmm. Okay, cool. So let me just try and recap. So where do they work? Yeah.
Yeah. Have like board certified.
Board certified.
Mm-hmm. Board certified. And then the university. Is it a well-known university?
Yeah.
Good university inside Indonesia or abroad?
Or
you
abroad.
Have to know. Yes.
Yeah, because it's quite common, I've noticed, with a lot of Indonesian doctors, they will go abroad for additional training. Is that called a fellowship?
Yes, we have fellowship as well.
What is the difference between university and a fellowship?
Like a university is just like when we got the plastic surgeon title.
Okay.
Yeah, for the fellowship it's like very specific. It's just like aesthetics maybe.
Okay.
Burns. And then specialties like that.
So you want to know what qualifications, whether they go to university, and have they done any additional fellowships?
Yes.
Okay, great.
And then the experience.
And the experience.
Yeah. How long that the doctor work?
As
10 years, 15 years, 5 years.
Yes.
And then what case the plastic surgeon like their
special procedure. Mm-hmm. Yeah. Okay. Great. So you think it's important for them to see some evidence?
Yes, of course. Before after pictures.
Before and after pictures. Great. And do you think it's important for them to like have a chat with the doctor?
Of course.
Yeah.
The good communication skill. Also, we have to know about the doctors. We have to do the video consultation. Is it like the communication skill is good?
Yeah.
Or how about the explanation? And also we can avoid the language barrier for that. And then can avoid some miscommunication.
Yeah. Do you think it's important for the patient to have like a rapport with the doctor? Like feel like they have like a vibe?
Yeah, of course.
Yeah?
Yes, of course.
Yeah.
If you don't like the doctor, don't do it.
No. Yeah, because you're kind of trusting your life a little bit as well as the result, right?
Mm-hmm,
yeah.
Of course.
Okay. Quick recap. The experience, the qualifications, additional fellowship, the environment that they work in, the evidence of before and afters, and how you feel when you speak to them.
Yes.
6 great points there for you. At Patient Concierge Services, I talk with different customers all the time. And one of the small barriers that I come across is we have a fantastic range of plastic surgeons here in Bali who are already extremely popular with the Indonesian audience, including Dr Tompi, who's widely famous, but the Australian market don't know about him just yet. And one of the questions that I'm repeatedly asked is, Indonesians have different features to say, Caucasians, whether it be the nose or the skin. And one of the common things that I hear about is the scarring can be a little bit more challenging on Indonesian skin than Caucasian skin. So for anybody who's watching, I'd really love to ask you that question is there a real difference from a plastic surgeon's perspective when you're doing, a facelift or a lower bladder, or like you say, a mid-face, lift? Is there really any difference between an Indonesian to a Caucasian face?
Yeah, the difference between the Indonesian and Caucasian face is in the anatomical structure.
Okay.
The Caucasian people, they have sharper angles.
Oh, really?
Jawlines.
Okay.
Yes. And for Indonesian, have the wider mid-face.
They have a wider mid-face. Okay.
Fuller soft tissue.
Fuller soft tissue?
Yes.
What's that?
The fat.
Oh, really?
Mm-hmm, the fat.
And is that easier or hard to work with?
the same. It's just a technique.
It's just a different technique. Do you think it's not really that different? Is it more challenging?
It's different. For like Indonesian people, to make it natural, we don't make it sharp. We don't make it pointy. No, it will be so unnatural. But for like Caucasian people, we do refinement, not augmentation.
Oh.
Something like that. Yes.
Would you say Caucasian is a little bit easier?
No.
The same?
It's just almost the same.
It's just the same?
Just different technique.
It's just a different technique.
Mm-hmm. It's from the anatomical structure.
It's from the anatomical structure.
But for the skin type, it's different. Like Indonesian people have like thicker skin compared to Caucasian. Caucasian have thinner skin compared to us.
Okay.
And then even though the Caucasian people have maybe less scar than we do, but we have to like very good handling in those tissue, in those skin, to avoid the irregularities on the skin.
To avoid irregularities. Mm-hmm. Okay.
In the scarring and something like that, yes.
Okay, that is so interesting. So the clinic is called Beautiful by Dr. Tompi. And for those of you who don't know who Dr. Tompi is, he is a very famous plastic surgeon across Indonesia. I believe 16 clinics now, I think, across Indonesia. And there's one here in Bali. So he predominantly works in Jakarta. He is a little bit more expensive than other surgeons, and he already has a wait list. And he's also a famous pop star, which is a very interesting combination. So you have been working for Dr. Tompi for how long?
Around 5 years.
Yeah? Mm-hmm. And what inspired you to work with him?
Well, Dr. Tompi, I think he is a genius.
He's a genius?
Yes.
Yeah.
His hands so fast.
Wow.
He is very creative in learning songs and creating songs.
Yes.
And then creating technique for surgery.
Technique for surgery.
Yes, like different technique, but with maximal results.
Yeah.
And then, he's very, very good. He helped me with my studies.
Oh, really? How did he help you?
Well, Dr. Tompi was my senior 5 years. No, 10 years ago.
Okay.
In university.
Yeah.
And then he nominated me to get my scholarship.
Oh, that's so wonderful.
Yeah, I look up to him so much.
Yeah.
And one day he called me and asked me to join this successful clinic.
Yeah.
I answered him, when do I start?
So he must have seen something special in you.
I think so.
Yeah.
I never asked him.
Yeah. So he's a genius. He's got his fast hands and his results are amazing.
Yep.
And is he like really famous in Indonesia?
Really?
Really?
When I go with him in the like shopping mall, everyone wants to take a photo.
Oh, really?
And I always had the cameras and then, okay, 1, 2, 3.
So how long was he a pop star before he became a plastic surgeon?
Maybe around 20 years or something.
Wow.
More than 20 years. And he's so famous. Pop and jazz.
Pop and jazz. Mm-hmm. I'm really learning now that there is a connection between creativity and doing plastic surgeon. There must be like something in the DNA or the brain that if you are creatively designed, then you have, I think, more of a skill or a vision to be able to help people with their plastic surgery.
Yeah, because
vision.
People is like a canvas for us.
Ah,
and
like
we draw in the canvas.
Yeah.
To make it beautiful, to make the picture good, something like that.
Yeah, so you have good synergy, good connection with Dr. Tompi, and do you feel like you're learning from him all the time?
A lot.
Yeah?
A lot.
Do you ever work together in the surgery room?
Oh.
Yeah?
Yeah, because before we can work in the clinic, we have like special study with him.
Yeah.
Couple of months with the technique. So every beautiful clinics in Indonesia have one techniques. We have same technique, uniform technique amongst all the doctors.
Technique.
Yes.
Wow. And do you know if Dr. Tompi has had additional training outside Indonesia?
Yeah, a lot.
Is it America?
I could remember because it's a lot.
There's so many. He's constantly topping up.
Yes.
And then he passes on that training to you and his other surgeons.
Yeah.
Amazing.
And like combine the training to the technique in Indonesia. Like we learn from specific countries with specific cases.
Okay.
For example, like Oriental eyes, we have to learn from Korea and Shanghai.
Okay.
Body contouring.
Okay.
Breast, buttocks, we learn from Brazil. Hair transplant, we learn from Turkey, and we combine everything.
Wow.
With something.
And to study Caucasian features, where would you learn? Which country would you choose to learn from?
Australia. America.
America, yeah. Fantastic. Okay, I really hope I get to talk to Dr. Tompi soon.
Yes.
Yes, thank you.
Yeah, to be honest, a secret.
Okay.
Okay. I have my own surgery for my body.
Okay.
Yeah, so I know exactly what the patient will going through.
Okay.
And for many patients, me included, will ask for more.
Ask for more?
Surgeries.
Ah, yeah. I have a saying for this. It's like decorating your house. You can't just do the one room.
Yeah.
True, right?
Yes,
Yeah.
if you do like on that side, maybe better in the side as well. Okay, that side, okay.
I think that's a really important piece of information, because once you've experienced the surgery, it isn't just about the nerves about the surgery. It's quite emotional too, I think. And for me, I say it's like emotionally, spiritually, physically, you really do go through almost like a dance with your own thoughts. Am I doing the right thing? What does this mean? Do I tell anybody? And a lot of people choose to do it alone because they're worried about the reaction from their family and friends.
Really?
Yeah. Still, many of our patients do it alone. Yeah, which I understand. When I had my plastic surgery, I did it mostly alone. I think I maybe told like 1 or 2 people. But once I was through the healing phase and I was feeling like victorious and celebration, I was like, check out my booty. For anybody who's watching who is outside Bali and is a little bit nervous about coming to Bali for plastic surgery, maybe it's their first time or maybe they haven't been to Bali before, is there any tips or advice that you can give them that might make them feel a little bit more reassured and relaxed?
Nervous is a normal thing, right? Because if you think seriously about this, you're getting nervous. So it's normal. So you have to consider everything, try to find many information as you can.
Yeah.
And then for us, besides the aesthetic goals, our priority is your safety.
Okay.
And then before we proceed with anything, we have to make sure that you're safe, in good condition, in prime condition, something like that. And then you're not alone in this process. Before surgery, inside the surgery, and after the surgery, we will be there for you.
I love that. Yeah. So you will do all of the pre-medical checks beforehand?
Of course, yes.
Yeah. What would that include?
Like laboratory tests.
Yes.
And it depends on the surgery.
Okay. Okay. But normally it would be like the blood tests.
Blood tests.
Possibly ECG.
Yes, ECG and
maybe
also
X-ray.
the X-ray.
Yeah. So that's really good. So you really prioritize, so you have all the information, and then it doesn't proceed unless you know that they are fit and well. And so if you're watching and you have any pre-existing health conditions, it's really important that they disclose this.
Of course, yes.
So
be honest.
Be honest.
Be honest is the best.
Be honest. Fantastic. Thank you so much.
You're very much
Thank you.